station. This is Bobo FM.
The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
At HSA, we strive to provide the highest standard of care with compassion, integrity, and dedication. And so we say thank you, Cayman, for continuing to make us the most awarded organization on island by voting us the best of Cayman Islands in 9 medical categories. Your support reminds us why we do what we do, to serve the Cayman community with kindness and excellence. To find out more about our award-winning services, visit hsa.ky. At HSA, we are committed to caring for you.
All right, welcome to Bobo 103.1 FM. It's Dane hanging out with you with a very special guest in the studios today. We have Dr. Lundie Richards. Did I say that right, doctor, by the way? Just want to make sure I get that right.
So it is Lundie. Good afternoon.
Lundie.
Yes,
Lundie,
yes.
Dr. Lundie Richards.
Lundie Richards. Thank you for having me.
Yes. How often do people mess up your first name?
Oh, all the time.
All the time.
Yeah.
So you're like me.
So you're in a good band.
Okay. I'm part of the band. Because for me, my name is Dane. D-A-N-E. It's spelled that way. But for a lot of people, they refer to me as Dean a lot of the time, or
Do
Dan.
they ever say Danny?
Danny, yes, yes. Some people go that far, but I'm glad I got the proper pronunciation for your name. Doctor, welcome to the studios. How are you doing?
I'm doing great. Thank you. Thank you for having me and for facilitating this particular session.
No, thank you for being here. It's a very important topic. We're going to be discussing, of course, breast cancer, but mostly around awareness. And this is the month for it. So I'm happy that you are here. You're an expert in this. You're going to find out why. So what I want you to do, doctor, is just tell us, which company you're representing, which is obviously going to be HSA, but how long have you been with the company and what's your specialty?
Mm-hmm. Well, again, thank you for having me. I am Dr. Lundie Richards. I'm one of the hematologists, oncologists. So let me break that down. Hematology is really the study and understanding of blood conditions, and oncology is looking at cancers overall. And I've been associated with the HSA since around about 2012-13, and I've been permanently here since 2019. So I'm an old boy in the institution.
Yeah. Still looking young, though, doctor. I'm not going to ask you your age, but you still look young.
I try.
Is that because you enjoy your job?
I love my job with a passion.
I could see that. When he came in for the interview, we always let people know what's going on behind the scene. So there was some confusion with the calendar, right? Mm-hmm. And you're the first doctor that's ever said, can you make it work? Because a lot of doctors would be like, well, that's good. Let me go back to work. I don't have to get on the radio. It's like an excitement day.
I always believe there is a way out.
Yes.
And once we are together, the question is, how do we make things work?
I love that. That's what you want from a doctor, though. Those are the qualities you want from a doctor.
Those are certain principles which we abide by.
Absolutely. All right. So October is Breast Cancer Awareness Month. Now, what makes this year's theme, every story is unique, every journey matters, so powerful?
This is a very powerful message because every individual is unique. And we listen to their stories. And by the way, men also have breast cancer.
Yeah, I've been told.
And we listen to their stories. And there may be some similarities across the board, but each individual is different. And it's important to really just listen and walk people through. And that's the only way we'll be able to support our patients during this journey. And so it's very important to have that, and I might use the word intimate relationship, when you listen to the story and you use that story to help them to go forward.
Yeah. Very important message too, by the way, because I'll be honest with you, doctor, before I go into my next question, it almost seemed like you could have described this condition or this, what do we refer to? We refer to name disease now? Do we call it, is that what we call it? Want to be careful.
That has evolved. Over time.
Yeah.
It's a condition, it's the disease, it's the illness.
Yeah.
It's that evolved over time. But the truth is, it is a cancer, and a cancer is a medical condition.
Yeah.
But it's a condition that we can control, and it's a condition that is treatable when diagnosed early.
Yeah. And my perspective of it growing up always was, if my mom was to ever get this word, it would be when she's an older person.
Oh, that used to be the thought.
Yes.
But now we find that, especially breast cancers, we have it at some early ages. I've seen in my career, I've seen 19-year-old with breast cancer. So it's not totally off to find very young people with breast cancer.
Yeah, let me that's a great segue into our next question. How big of a problem is breast cancer globally?
Across the world, it's a huge problem because we have somewhere near to 700,000 women dying of breast cancer every single year.
So 700,000 is not hearing the word I have breast cancer. 700,000 is the amount of deaths that we have.
Death that we have.
Insane. That is crazy. That's a huge
it's millions.
number.
It run into the millions in terms of new diagnoses every year.
Does that not scare you as a doctor to study this specialty?
Unfortunately or fortunately, I've kind of gotten used to it. When you're in this business for 30 years plus, you kind of get used to it. But we go back to the first question about the uniqueness. Every story is different.
Yeah.
And so despite the fact that I've seen thousands of women with breast cancer, every one of them have a different story, and it sounds different. So the importance of recognizing how broad it is therefore we know that women form 52% of the population globally, and women work hard. They're a tremendous part of our workforce.
Yeah.
At the same time, many times they are the nucleus of our families. And so we have to take care of our women to make sure that they're able to contribute to family. They hold the family together. And also, because they're such an important part of the global workforce, to make sure, we can decrease what we call the morbidity, which is the illness surrounding the cancer.
Yeah.
So they can be productive because they want to be productive.
They do.
And so we can help our women to live as healthy a life as possible.
Yeah, I love that, doctor. Now, we talked about that number, which is still stuck in my head, and it has surprised me. And that's why knowledge is power. But I want to know the biggest knowledge, I think, not, boycotting anything that's happening around the world, or not saying it's not important, but what does the picture look like here for Cayman Islands? What do the numbers look like here?
And so what we have discovered here in the Cayman Islands, that at least a third of our cancers, 1 in 3, is breast cancer.
Yeah.
So to us, that is significant. And in terms of the age group, we have the vast majority of our breast cancer that are diagnosed under 60 years old. We have numerous women who are within their 40s. So these are young, productive women.
Yeah.
And so we think that is critical, and we need to come together to really address it. And yes, we are, as a country, we are pulling together to address it. Certainly, HSA has its program in place, and it's doing as the premier center as far as the government facilities is concerned, is really doing its best in terms of outreach, awareness, screening, and also to provide treatment strategies. We are doing our very best. But, there are other institutions, including the NGOs, that also participate.
Yeah, man, you guys are definitely, I can echo that. You guys are doing a wonderful job in that area, in that arena. But you mentioned the age also, just to bring things closer to home. My wife is 40. So if she was to ever be told that she has breast cancer, it changes the landscape for her a lot, because, we're still raising a 10-year-old. Yeah, we have older kids that we're still...
Not only changes for her, it changes for you.
Yeah.
It changes for your 10-year-old.
Yeah.
And how that landscape change, it's a whole life-changing situation. And it calls for understanding, or men need to understand, or women. We have to be there to support them emotionally. And we have to be there because she's going to be asking herself all the time, why me?
Yeah.
What did I do? Why did I not do? What did I eat? What did I drink? Did I sleep enough?
Yeah.
All of these things. Oh, something hit me here. It's all kind of questions that are going to be asked. And sometimes it's not easy. And sometimes the person needs psychological support, group support, as well as sometimes seeing a therapist, because it helps in the whole healing process.
And just the understanding too. I think that's where we come in as a man and husbands and fiancés, boyfriends, no matter what role you play. Mm-hmm. If you're with that individual, then you play a very important role.
Yeah.
You spoke earlier about, other entities that are joining and helping. So I want to understand the role that the Cancer Society is conquering cancer symptoms this year. And you spoke about breakthrough in cancer care. Can you share some of those insights to the listeners today? And also just checks that can be done and what's changing on the front in technology, that is.
Yeah. So, as I mentioned, the NGOs are pivotal. Breast Cancer Foundation, Cancer Society, they help in terms of providing funding for screening and so on. But certainly coming back, the HSA really accommodates people. And one thing I can tell you about the HSA, even sometimes people do not have the necessary coverage. But HSA never turn away people.
Love that.
Never turn away people. HSA is there to help everyone through their journey.
Yeah.
Right? Turning to the whole breakthrough, science is evolving every single day. And what is good news today, tomorrow is stale news.
Yeah.
Right?
Yeah.
And certainly when you sit among your peers in these international fora, you recognize that, hey, did I learn that last year?
Yeah.
Oh, that's still news.
Yeah.
But certainly some of the things that are coming out, and perhaps we can help to identify. Everybody hear about AI, for example.
Big one.
Big one is AI, and AI is in everything. Mm-hmm. And AI is also playing a significant role in cancer care. One, let us be very clear. AI does not replace human being. They have taught AI how to try to think and so on, but it has not replaced human being.
Yeah.
But AI can handle things like massive data, can correlate and collate things. And certainly in the field of breast cancer research, AI is pivotal.
Yeah.
But coming back around, for example, in diagnosis, what has happened is that you will find that because for cancer diagnosis, you need the human being to actually look at the cancer tissue largely under a microscope or sometime using different tests, but you observe, you look and see what is there.
Yeah.
And oftentimes in certain types of breast cancer, and the ones that are usually, we call it HER2. I don't want to, it's a long name, receptor.
Yeah.
Which is usually kind of an more aggressive form of breast cancer. But sometimes that marker, it might be dull as opposed to bright. When it's bright, all the pathologists see it. The pathologists are the doctors who look and diagnose. But when the feature appears dull, it can be missed.
Yeah.
And two pathologists could be looking at the same thing, and one will say, yes, this is positive. The other say, no, it's negative.
Yeah.
And what AI has done, it has taken that information, married it, and therefore help in terms of making the diagnosis more accurate.
Yeah.
Why is this important? You need accurate diagnosis to provide the optimum treatment. AI is also important, certainly in doing like the breast scanning.
Yeah.
Mammograms. AI has been integrated in there. And it's again because the human eye sometimes may miss a little thing or may not be sure. Hey, this looks like that. Oh, is it really? You get an opinion from their side. Yeah, maybe it is. Maybe it's not. Now, what the AI would do, it would take all this information and various images and put it together and say, it is positive or no, it is negative.
Or give you something else to look at.
That is how AI has helped. But AI will not replace human.
Yeah, you know what? I've always said it can coexist. And I've always asked a lot of doctors that have come on the show, it's better that you work along with AI and not think that AI is the future in the sense that it will take over. Because there's a lot of jobs that AI just could not fulfill. And I'll be honest with you, it would put a lot of anxieties in clientels and customers and patients. Because if I know now that a doctor is being replaced by AI, that surgery, in my opinion, would probably be off the table, right?
Exactly.
But just to give a little bit of feedback and testimony on my side, I recently went in to do a test, and I can be very open about it. It was obviously a prostate test, because it runs in my family. You know, my dad, my uncle, my grandfather, unfortunately passed away from prostate cancer. My dad and my uncle caught it early, and they got tested. They did it the old-fashioned way. The test was done the old-fashioned way. I went into a medical center to do a test, but it was done with AI. The entire time, till this day, I am saying, I'm calling my dad back and forth, Dr. Richards, and I'm saying, man, I wonder if I should just go and do it the old-fashioned way, because this is scary to depend on AI. I always use the terminology that I might as well just eat the barracuda that the ants tested. Right? Because I just don't, I don't know. Call me ignorant or whatever you want, doctor, but that leads me to my next question. Can it improve the results? Can AI actually do it? I know you stated it before and how it works, and how you can collaborate with it, but are you as a doctor, do you trust the product?
I think AI has proven that it can improve our diagnostic accuracy, right? It is machine training that looks at minute information and pulls it together. And so in that way, it can assist.
Yeah.
I don't think, let me put it this way, I'm being politically correct. I don't think we reached that level yet where we can just allow the AI to do what it wants to do. And you take simple things like people put things into GPT. You say, tell Chat GPT to write this thesis for me.
Yeah.
And it does it.
Yeah.
And it does it with beautiful references. Mm-hmm. But if you read it, you realize that you're going to be in problems if you submit it like that. Right?
Exactly.
And not to mention plagiarism.
Yep.
Right?
Yep.
But the whole idea is that it puts a lot of nonsense there. Mm-hmm. So you have to be careful, you have to be judicious. Right? So even simple thing you drop into chat GPT, you tell chat GPT, oh, I'm having my belly's paining me. Or it gives you a whole heap of pretty things. But those may not necessarily be true. So no, we cannot depend on AI for everything. It will help, but no.
From a creative standpoint, too, I've figured that out myself. Like if you were, from a creative standpoint, if you were to say, put together something for my morning show this morning, if I want from 6 a.m. till 11 o'clock, live in the Caribbean, this is the station identity, these are my audience, I want you to come with a compelling show. A lot of people in the creative field will refer to it as corny because the things that it comes up with it's things that you would never imagine even bringing to your audience, and it would not attract your audience.
No.
It wouldn't. So you still have to go into it, and there is some things, the format that is set that you would say, I can use this. I can take this and I can make it mine. But I heard a good friend of mine, a mentor of mine, said you can use it, but don't depend on it to come out with groundbreaking ideas. Human beings still need to be that.
Yes.
And I'm just scared, which we can talk about further in the show because we got so many questions before we take this break here. I'm scared for my kids that are growing up in this generation, because I think it's creating like a cup of noodles soup type generation. It's quick and they're no longer thinking, and they're becoming very lazy.
Yes.
Because AI can do that.
Yeah.
And they don't make their brains operate anymore. Mm-hmm. Compelling conversation, but I don't want to steer away from the meat of the matter, which is surrounding around breast cancer awareness. So when we come back, we're going to discuss that more. It's a pleasure to have Dr. Richards in here. And don't worry, folks, if you have any questions, you can go ahead and send it into our Instagram at Bobo103.1 FM. We'll proudly go ahead and give that to Dr. Richards so he can get back to you and give you maybe something that was not answered, we can get that to you. We'll be right back.
HSA's orthopedic clinic has relocated to the second floor of the Smith Road Medical Center. Our dedicated team of highly skilled orthopedic surgeons treat conditions ranging from spine to ankle injuries in adult and pediatric patients. We offer minimally invasive procedures from ligament reconstruction to hip and knee replacement. If you have experienced an injury due to sports or day-to-day activities, call 949-8600 and schedule an appointment with HSA's orthopedic clinic, now located at the Smith Road Medical Center.
Welcome back to the show. It's Bobo, 103.1 FM. I am your host, Dane. And don't forget, this show is dedicated right before the BBC, dedicated to all things HSA. It's a pleasure to be here today with, of course, our guest of honor on the show for HSA is Dr. Richards. I'll have him explain himself just again to our new listeners as they're coming on board for the first time and listening for the first time. Just his, of course, his specialty and how long he's been with the HSA entity. Just for those that have missed it before. So, Dr. Richards, welcome to the show.
Thank you very much. Thank you for having me back, and thank you, listeners, for joining. Right. So, I have been with the HSA. I started with the HSA part-time from around about 2012-13, and then permanently since 2019. I've thoroughly enjoyed HSA. I love HSA. It's a family.
Yeah.
And HSA answers a lot for me in terms of my own specialty, which is in hematology, which is to deal with blood diseases and blood cancers, and oncology, which deals with mostly what we call solid tumors. These are cancers, breast cancers, colon cancers, and such the like. So we married this specialty, and I thoroughly enjoy the practice of it, and the family affair, certainly in terms of dealing with all the people who come across us.
I love that. My daughter is on her way to take a career up in medicine. And
Excellent.
she wants to do trauma surgery. And she gets that all the time. And it was just a couple of days ago, I was telling her, like, it's time to probably I don't want to, redirect you to something else. That's not my goals. But it's to also remind you where you're coming from, because she gets very, I'm pretty sure it's the same thing for you too. She gets very frustrated if she's not where she needs to be right now. Thinking like a doctor, I can imagine, right? Mm-hmm. And I'm saying, man, you gotta understand where you're coming from. Like the masters that you have obtained, the schools that you have attended. Mm-hmm. This specialty that you're about to get into is it's not easy. And I have interviewed so many doctors from the HSA, Dr. Richards, that a lot of them has changed their specialties along the way.
Yes.
So that's why I wanted to ask you, was this always something that you wanted to get into?
No, it wasn't. In fact, when I started medical school, I smiled because, the sexy thing then was to be a surgeon.
Yeah.
Whichever surgeon it was going to be, I wasn't sure. And in fact, right through medical school, I spent almost every day, despite the fact I was doing all the other things, I spent every day doing at least an hour or two in something surgical. So by the time I graduated, I was a budding surgeon. Mm-hmm. But then tragedy struck.
Oh, wow.
My dad.
Emotional topic. Yeah. Can see it.
He had prostate cancer. Wow. My dad was my best friend. He was everything to me. So that's why I'm in this today.
If you don't mind me asking, how long ago was that?
91.
91.
Mm-hmm.
And it still affects you to that way?
Oh, yeah.
Yeah.
My dad was everything to me.
It's funny, doctor, because you just answered the why. Mm-hmm. It's a big question I always ask at the end of the show, but you just answered the why. And you're making me emotional too, seeing it, because I can see he was your best friend, but... Yeah. I truly believe, and I don't think you need anybody to repeat this to you. I think I know he would be proud of you.
Yeah.
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 And just to see your enthusiasm and how you love this field, but how you take it on too. How you take it on. So that's one of the reasons.
And that's, it's the passion and it's the zeal to do things to help people. I watched my father suffered and died. And I couldn't do anything.
Hard. You're doing it now. You're doing it now.
So that's why I'm doing this today.
Yeah, you're doing it now. And a job well done, from what I can see. Sorry. Just met Dr. Richards for the first time, but I was telling him earlier he walks with authority and purpose. So just reminding him of that. We don't praise these moments on the radio, but I love the truth. I love the truth behind your passion. So I wanted to ask you, just so we can put you to a different zone right now.
Yes.
And I love that you spoke about your dad, and thank you for trusting the audience with that.
Sure.
But can we talk about, in your presentation, you spoke about liquid biopsy. What is that?
Yeah. So normally we're used to the biopsy, which is sticking a needle in or cutting out a little piece of the cancer and sending it off to the pathologist, who will read it, look at it, read it, and come up with a diagnosis. Now, what we have found is that the blood bathes cancer cells. And so therefore, little fragments of the cancer will always or should always be in the blood. Mm-hmm. And so liquid biopsy is really testing the blood for certain specific cancers.
Yeah.
I think they started back a few years ago with colon cancer, and now this has evolved into breast cancer, and it is becoming a very, very important tool. Why is it important? It's important because instead of trying to find something to cut out, so you would you might do the liquid biopsy sometime before you start treatment, and then you use it along the process to see what is happening next. Is it disappearing or is it increasing?
Yeah.
This is specific for it. And also it's important, it gives you prognosis, meaning, so you treat the cancer, you have done the biopsy, you have done the chemotherapy, you have done the radiation, you have done the surgery. And then it's a way of monitoring. Is it coming back? As simple as that. And one of the things that has been approved, I think earlier on this year, late last year in the NHS in the UK, is that they have approved liquid biopsy as part of the whole management strategy around managing breast cancers.
Yeah.
Right? And so it is becoming very, very important. It's non-invasive, it's quick, it may be costly. A couple of years ago, we started in terms of taking the specimen from here and shipping it off to a company in the US. So it can be pretty costly. But I think with more players coming on board, they have gotten less costly.
Yeah.
And so it is something that is available, but not we don't do it on island.
Okay.
But once we have the link with a particular company abroad, we package it and send it across. And, we do a lot of things from here in Cayman.
So that answers that question, because I think one of the next questions that we had for you, if it was available here. So you just basically answered that. So thank you for that. But also, liquid biopsy, is this just the newer way of checking, you would say, to see?
It is a much newer way. It is non-invasive or less invasive, and it gives you quick answers. And because when you're looking for these minuscule particle, you're looking at the DNA. It's not something you can see under the microscope.
Yeah.
This is something that has to go through a process. If you watch TV shows like Law and Order and CSI, you'll see they go on to trying to find DNA. So it's not something you can really see.
Yeah.
So they'll actually look for the DNA associated with these cancers, and you're able to monitor them. It's not available for all cancers, but certainly the one we have on board with breast cancer, it's available. And I certainly know it's for colon cancer as well.
Amazing. So I want to ask, so you said that if you want it to be done, it's something that you can facilitate, and most of the time, sometimes you guys will bring it down. Do you recommend someone that urgently wants to get something like this done? are these technologies only available in big countries?
Well, as I did say, that it's available in the NHS as part of the whole management. Definitely, and again, technology and cost, things like that does not filter down to the wider world. You know, it's only lots of these things are mostly available, I would say, in general, in the well-off countries economically, or even it's available in the less well-off countries, only available to a few people who can pay for it.
Yeah.
Right? One of the great things and unique things about Cayman Islands in the middle of the Caribbean, which is largely a poor area, is the kind of coverage that's available for the population. I've not seen it anywhere else. And that's what makes access to healthcare in the Cayman Islands so beautiful. So beautiful. Right? It is costly.
Yeah.
It is costly. My former vice principal in high school said there's no such thing as a free lunch, which is true.
Yeah.
It is extremely costly, but it is these things that are made available to the population. It is just something to behold, because even the big mighty United States, the general population do not have the kind of access that the population in the Cayman Islands has.
Yeah.
Right? So coming back to that specific thing, yes, they're available in the big countries, but Cayman Islands, it's a small country. But because of the kind of coverage that's available here, then a lot of these new technology, if they're not yet available, they're going to be available very soon.
Yeah, which is always true. Cayman is ahead when it comes to technology. Would you go as far as saying, because you must have traveled and seen what the rest of the world is doing in some territories, would you say that we are more ahead in a lot of countries
I
that you
think
visited?
we are.
Yeah.
I think we are more ahead. And I know, for example, at the HSA, we are, if you look very carefully here, the Cayman Islands Molecular Laboratory, which is growing and the offerings are increasing.
Yeah.
So what you'll find is that soon and very soon, a number of things that we'd obtain off island, they will be able to obtain them on island.
Yeah.
And at less cost.
Yep. I'm seeing it now. Now, you're talking about new technology. You're talking about how ahead we are. And obviously, you spoke about something very personal before. How can we dig into this topic now, which I kind of find out that we're doing a really good job, or maybe we're not. How can early detection really change the outcome of somebody's life?
No, that is key. I mean, but if prevention is better than cure every time, right? Every time prevention is better than cure. So just want to touch on that a little bit. There are things that we can do, and there are things that we cannot change in our life.
Yeah.
So we cannot change the fact that we have a family history of cancer. We cannot change the fact that we might inherit a gene. We cannot change the fact that we're exposed to environmental radiation. Yeah. Although, we say to the world, hey, we need to decrease this and that. But in general, what are you going to do? Put up something around the sun? You can't do that.
No.
So simple things like that.
Yeah.
Those are things we cannot change. But yes, there are things we can change. We can exercise more, meaning we park far away from where we work. And we walk, instead of parking at our doorsteps at work, let's walk 100 yards.
Yeah.
That helps.
Yeah.
Instead of sitting down 4 or 5 hours without getting up, get up. Walk around, walk into the office. Yeah. And just simple things. Drink water.
Yeah.
Drink water. Water is our best friend.
It is.
Have nutritious diet. The whole Cayman Islands is surrounded by water, which people flock for every day. Come on. We can go to the beach, enjoy the beach, go swimming, exercise. We see a lot of people do walking and running. We need to increase this. So I'm talking about personal things. And of course, smoking.
Yeah.
Smoking accounts for many cancers. And so these are things that we can modify, right? Even if sometimes we have inherited some kind of adverse gene that may predispose to cancer, then what we need to do is to recognize it early so that we can do the necessary screening early. And therein lies now, what are there things we can do to prevent it? And then, okay, let's say we have not prevented it. But if we do our early checks, our early medical checks, we go to the doctor, even if we're feeling well, once or twice a year, we do our basic screening, including for our men to do the usual test when you get to 50 years old, right? Looking for prostate cancer in our women. Learn to examine your own breast. You know, do our mammograms every 2 years once we get to 40 years old. Do a pap smear, right? And then when you might reach up to 50, 60, your doctor may order certain scans, even a chest x-ray. These are things that may help us for early detection. When we detect cancers early, then the chance of a curative treatment is extremely high.
Love that. That's very important too, folks. We've been talking about that a lot, especially on my morning show that I do completely away from Bobo. But usually when we get a lot of entities on to talk about early detection, we do a lot of these fundraisers that we see out. And we're so lucky to live in an island where a lot of these screenings are done free on a year-to-year basis. So I find that to be very rewarding. Moving on, since we are in this, we segue to this. What's new in breast cancer treatment?
Oh, there are lots that are new in breast cancer treatment, and a lot of things are really in the trial phase. But when you look at them, these trials look very encouraging, because once things get to what we call, you can see them going through different phases. Phase 1 is really where they deal with rats and so on. But when they get to phase 3, they're dealing with humans, right? And they're just really putting on the final touches. Certainly, one of the things that has come about, I spoke about the HER2 cancers. In the yesteryears, 10 years ago, it was regarded as, oh my God, this is a very, very bad cancer. It is still an aggressive cancer, breast cancer. But what has happened is that we have developed various forms of immune treatment that are targeted to this HER2 molecule that's on the breast cancer, right? And so the aggressive nature of it has now toned down, and it almost becomes standard, and it's standard of care, certainly in places like the Cayman Islands, because of what I mentioned before, the access to care, right? Certainly in the less off countries that are our neighbors throughout the Caribbean, it is not so. But thanks to the system that is here, that really, really looks out for its people, right? We have access to those. There's another type of cancer which is still regarded as very aggressive, is what we call it triple negative. Now, I often say to my patient, what is that? Now, in every cancer, the only question you keep asking is, why did I get it? Everybody asks, why did I get this cancer? And most times we don't know. However, again, in something like breast cancer, we look for certain things that we think may drive it. We look for the hormones like estrogen, which a woman has, progesterone, which she has, and the HER2, which may come. Right? And so sometimes, as I mentioned before, the HER2, right, is usually seen as aggressive. But when a woman does not have any of these markers, we call it triple negative, then you have nothing to target. But yes, since the past few years, with different forms of immunotherapy, the whole treatment of triple negative breast cancer has changed. Women are surviving more. Those women who have had, unfortunately, their disease progressing, they have the spreading of the disease, they are doing much, much, much better, and they're living much longer with this horrible type of breast cancer. And for those who are in the early stage, the curative intent of treatment is working. They're living much longer without any relapse.
Yeah, very true. We have stories in here, too, in our very own Stingray Media entity. So thank you so much, Dr. Richards. We're going to come right back after this short commercial break and talk more about this specialty and the awareness around breast cancer. So make sure you don't even think about touching that dial. We'll be right back. Tell a friend to tell the next friend and tell the next family member until they're on this dial and they're listening to this. We still got about 10 more minutes left into the show, and we're going to, of course, wrap it up very soon. But if you have any questions on your own that you may not have the answers to right now on the show, just go ahead and send me a message on, of course, our Instagram messenger. We'll see right away. We'll pass it on, of course, to the good doctor. It's Bobo, 103.1 FM, Cayman. You can put the Cayman at the end of it in order to find it faster on Facebook or Instagram.
At HSA, we strive to provide the highest standard of care with compassion, integrity, and dedication. And so we say thank you, Cayman, for continuing to make us the most awarded organization on island by voting us the best of Cayman Islands in 9 medical categories. Your support reminds us why we do what we do, to serve the Cayman community with kindness and excellence. To find out more about our award-winning services, visit hsa.ky. At HSA, we are committed to caring for you.
Welcome back to the show. It is Bobo 103.1 FM, and you are on with, of course, my name is Dane. I am the host, of course, this very special segment that we get to do here with HSA. If you are just joining us for the first time, we usually use this segment that is all brought to you by HSA, is to talk about maybe a conference, an awareness, a specialty, or maybe an experience area at HSA that you didn't know about. I think the meat of the matter for the show is just education. It's all around education and things that you just didn't know about HSA and what they're doing, and probably areas that may be very sensitive for you, or probably an educational tip for you. Regardless of what it is, it's meant for education and help. All right. So if you have any questions that you may want to ask the good doctor, or any specialty that anybody that has a specialty that comes on, or maybe there's a conference that's coming up, we'd love to answer it for you. So just go ahead and send us a message at Bobo 103.1 FM. Dr. Richards is joining us today. I'm going to have him, of course, do something that he's very familiar with, and that's reintroduce himself, talk about his experience and how long he's been with HSA, and what the topic is today.
Yes, thank you for having me back. Yes, I've been with HSA since about 2012-13. I was initially coming part-time, and then since 2019, I've been here full-time. I've been in the field of practicing for, since about 1992, 93, which is quite a way back. So I specialize in hematology, which is the study of blood diseases and blood cancers, and medical oncology, which looks at cancers such as breast, colon, lung, and so on. I thoroughly enjoy this work. I feel I help people, and it's my calling, and I enjoy it.
Certainly agree with the
HSA has provided that platform for us to do that.
Absolutely. Certainly your calling, for sure. We can see that, and I'm pretty sure the listeners can hear that also. Now I want to ask you, doctor, for women that may be listening right now that might be afraid to get screened, what would you say to that young lady right now, or any lady that's listening, for example, to the radio station at this moment? How would you help them to give them that nudge to realize this is a good thing?
I think the first thing it is to accept that you're scared. Acknowledge it.
Yeah.
Because cancer itself and a diagnosis of cancer is scary. Mm-hmm. But the scary thing is for you to have it and don't know and don't do anything about it. So that is even more scary and more detrimental. So I would recommend, go ahead. Go and speak to your practitioner who can examine you. They may ask you things that may help to really look to see if there are possibility, and then they'll recommend a mammogram. And even if you don't want to go to a practitioner to have a mammogram, you can go to, for example, like I think, the Breast Cancer Foundation or Cancer Society, and they give you a voucher and you come over to HSA and have your mammogram done. And the mammogram, yes, it's not going to increase any risk of you getting any cancer. It's pretty straightforward, pretty simple. And in a few minutes, you'll be out.
Yeah.
And then you'll have an answer which will at least give you some kind of appeasement for a short time. A short time mean a year, 2 years, and you know that, hey, I will have to go back in another couple of years and have my test done. But it is as simple as that. It's not going to cause you any harm, and do not delay. Just go now. See your practitioner or get a voucher, come to HSA.
Yeah, that's a powerful message too. And obviously, I'm not a woman myself, but I can speak for all the men out there because men can suffer with breast cancer. But I remember something silly happened. I refer to it as silly, but it was an eye-opener for me when I was driving home and I was extremely dizzy for some reason. I just felt just all type of ways. I don't know if I had an anxiety that day or what it was, but I just kind of felt like the world was coming to an end. I was looking at my younger son who was driving in the car with me, and I was like, man, is this the last time I'm going to see my son? Because I've always stated that I was very much this ignorant. I can use the word ignorant for myself. Very much if I said if I was to ever receive prostate cancer, I would just make it happen. I don't need to know. If it happens, it happens. That's just how I want to look at it, because I didn't want to go through the old traditional way of being tested. Like I said, ignorant mindset of a very young age. We all have it sometime, right? But you know what made me really think about it was, like I said, my 10-year-old sitting next to me. What if that time is cut short with him? If you don't know, you don't know. So I may not get to see him get married. I may not see him get to have kids. I may not hold my grandkids in my hands. And those things, believe it or not, if you're a family person, that affects you. So you do want to know. That scary moment of, but if I find out, it's worse. No. If you find out, you are basically setting yourself up from an early stage to say, well, I can live longer.
Correct.
And I can fix this.
Correct.
This can be fixed. So that, to me, is better than knowing. To know the fact that you can fight this.
Correct.
Right? You don't want to find out to 15 years, 10 years down the road.
When you're at that time, your life is really short.
Yeah, it is. And you live in regrets. And nobody wants to live in regrets.
Exactly.
You know, I always say to somebody that I've never said, man, I shouldn't have gone to the gym today. I shouldn't have gone to the gym. I've never, I regret walking in, but I never walk out saying, I hated I went. You feel refreshed. You feel something good. So it always feels, it's going to feel, I'm not going to lie to you. I'm not going to mess with your emotions. It's going to hit you hard if you heard that you have cancer. Yes. But if you caught it early, that's a feeling that's different. That's a really good feeling to hear the doctor said, but we can fight this.
Yes.
We can fight this. And I think those are the things that you want to hear.
It's bad news and traumatic news to hear at the very beginning.
It is.
And we have to face it.
Yep.
It doesn't mean going around the corner, you have a little something. No, the person has a cancer.
Yeah.
And this is what it is. But this is what we can do about it together.
Yeah.
And that's the important thing for patients to recognize that you're not out there alone. We support you.
Yeah.
And we're going to walk with you through this process.
I love that, because doctors never leave your side. They're going to fight with you. It's a good word to use. You mentioned this earlier, but just for the new listeners, let's go back over this again. Just some of the things that you can do, lifestyle choices that you can do to reduce breast cancer.
So I think earlier I mentioned that there are things that we can't do anything about, right? And some of these include, we can't change our genetic makeup. We can't change how we were born, right? But we can certainly change things like not smoking. We can live healthy lifestyle, our diet. We can limit alcohol, because believe it or not, the more we drink the alcohol, the more we are predisposed to having cancers. The weight, manage our weight.
Yeah.
Right? Because when we are overweight, then the stress on the body, the various chemicals that the body produce, all of these predispose to cancers. So regular diet, good diet, regular exercise, limit alcohol, eliminate smoking. these are things that we can do. And of course, early screening. That's always part of it.
Yeah, big one, huge one. How can the community get involved this October, Doctor?
So the community, I think one of the things is look out and see the stories of women, especially women who has had breast cancer. And we do have a few men who have breast cancer too. But see those stories. Join the local walks. Join, when things are happening, when the different organizations are having these cancer talks. So you can be part of it. So you can begin to understand and spread the good news and really help your neighbor, your sister, your brother to go and get tested, to go and get screening, and also to participate where possible as a volunteer. These are ways we can help each other.
I love that. Really good feedback right there. And Doctor, it's been a pleasure having you on the show today. Sad to say that an hour has passed by that quickly. This has been one of our best conversations for the year, only because it's impacted our country so much. And it's an important conversation to have. And you just gave stats around it too that shows how important this conversation is to have. So before I let you go, it would be wrong of me not to give you some key takeaways from your presentation today around breast cancer care that you would like to just remind our listeners and the listening public, anybody that's listening or re-listening to the show again, just some important information that you would like to leave them with before you exit.
Mm-hmm. So thank you. So breast cancer care has been evolving, it's changing every day, and it's moving very, very quickly. Early detection is important, but what this allows is for personalized care, because no two people are the same. And so we organize care around the individual. It's important for us to have community awareness and personal awareness. And we recognize that cancer is not a death sentence, really. And we can survive this. We can beat this. And we need to listen to our stories and help each other as we move along. Because our families who have cancer need our support, and we know we can beat this thing together. I want to thank you for the opportunity.
I want to thank you for being here, man. I never knew that we were going to have you here today, but it's definitely been the best part of my day so far. And thank you so much for sharing your knowledge, your expertise, and a little bit of your personal story.
Yes, thank you.
We love that, Doctor. We don't get that here often. So we love that you were open enough to share that with us today. And we hope we get to see you again. This is not the last time. Yeah.
Thank you.
Have a wonderful day, Doctor.
All right.